Hey, welcome to another video from SkinnyMedic. In this video, I want to talk about the treatment for minor burns. When I say minor burns, I mean minor burns, okay? I'm not talking about anything with blisters or charring or anything like that. This is just minor burns that have some redness to the skin. And we start talking about first-degree burns, and these are superficial first-degree burns that have redness only. One of the first things I think about is like a sunburn. Okay, you've been out on the beach, been outside working, whatever, and you get sunburnt. That's typically a first-degree sunburn, and you get redness all over your skin. It's very painful. You can get blisters with that, but typically we're talking about just a first-degree burn here with sunburns, redness. But fire obviously can cause a first-degree burn. You get hot water that gets spilled on you. You touch something hot that's metal, can cause a first-degree burn. You've got chemicals that can cause a first-degree burn. Electricity can cause a first-degree burn. So there's a number of things that can cause these first-degree superficial type burns. So with first-degree burns, you're gonna have some redness at the site. You can also have some swelling. You can have some pain associated with this. And then once it starts to heal, you're gonna get some dry peeling of that first layer of the skin. Now typically, first-degree burns take about 7 to 10 days to heal. So once we've removed the patient from the source of the burning, we're gonna flush whichever part of their body is burned with cool water. This could be an arm, a leg, whatever. We're gonna flush it with cool water. Try to avoid ice. Don't use ice water, it's too cold. But just cool water for about 15 to 30 minutes. Personally, I avoid butter, mayonnaise, and stuff like that on these types of burns. I personally, and everybody has an opinion, you can do with that what you want. I have found that putting the oils, like the butter and the mayonnaise, on these types of burns actually makes the burning worse for the patient. So after you've let it run in the water for about 20 to 30 minutes, dry off the hand or whatever you need to this burn with a clean, dry cloth. I probably would avoid rubbing the towel real aggressively across the burn, just kind of patting it dry. If you want to put some of the aloe or some of the burn gel on there, you can if you want to. But this burn is going to heal on its own. We're going to let it naturally heal. It's going to heal. But sometimes the natural aloe, the burn gels, do help with some of the pain relief here. These burn gels here, they have bandaging as well. This is gel, of course, but then they have bandaging. They contain lidocaine, so it's going to help with pain. So you'll see a lot of these commercially available, and they do really great for these types of burns we're talking about in this video. So 24 hours after the initial treatment here, we're gonna wash it. You can wash it gently with some soap and water. If you want to do some betadine, wash here as well. You're trying to prevent infection. Just make sure your patient's not allergic to betadine or iodine before you do this. But at the very least, I would wash it with some soapy water to keep it clean. You want to try to prevent infection. You can also use the betadine. I like the little individual swabs. That way you're not having to open up a whole bottle of betadine. You can just use the little small packets here, especially if you're dealing with minor burns, like if I had on my hand here. Then these little small betadine packets work well, and you don't have to worry about opening up a big giant bottle of betadine. If it's a large enough surface area on the skin and you're concerned about it, you can wrap it with some 5x9, some 4x4s, and some cling to kind of keep it protective from the environment. There again, it's painful. First-degree burns are painful, but we just want to make sure it doesn't get infected. That's one of the big things with burns is the infection post that initial response. So make sure we keep it clean, and it should heal on its own. So some of the things I read about post 24 hours initial response to these burns is putting some vitamin E on the burn itself. That's going to prevent scarring. The burn centers use the silverdine, so you can do colloidal silver, silverdine dressings as well. Honey is a good natural antibiotic here as well, so you might look at doing something like that. So you've got quite a few options post 24 hours, but we just want to make sure that we keep the wound clean. First-degree burns can be painful, like we've talked about before. So if you want to look at taking some ibuprofen, some Tylenol for pain management, it's probably appropriate.